I am the Regional Infectious Disease Specialist. I've been with the same company for 21 years. And I was board certified infectious disease. I had just come out of my fellowship and they wanted me to mainly treat HIV patients. And I cover every correctional facility in the Philadelphia prison systems. I was doing my fellowship in infectious disease at what was then called Medical College of Pennsylvania. And in February of 1994, something came upon me to go in my library, which consisted of the entire Charles Dickens series of books. He's my favorite author. So I go and I went like this, and my finger stopped at Little Dorrit, and I started to read about it. And it was about a prison. So I'm reading this morbid book and thinking, this is depressing. I don't know why I'm reading it. I put it on my nightstand, and then I get a call from one of the infectious disease attendings at work saying, there's a job opportunity working in a prison. And I'm praying to God to ask me, which place should I work? And when the time came that I had to make the final decision, I walked out onto my porch and I felt the sun in my face. And I knew He wanted me here. So I never looked back. And what I realized was, these are not prisoners, these are human beings that I'm treating, and that was it. Once I realized that, I didn't treat anyone differently than when I had a private practice and when I was doing internal medicine, and that was it, and that's how I feel to this day. I struggled with some excess weight over the years, and about a year and a half ago, I was reading an article about Ernestine Shepard. She's a 77-year-old female bodybuilder who began her journey in fitness in her 50s. So I thought, wow, I'm in my 50s, so if she can do it, maybe I can do it. So I started to track my food intake, February of 2014. Within a week, I lost 3 pounds. Next thing you know, I'm losing like a pound a week, pound and a half a pound. By the summer, I went from 180 to like 165. And then right now I weigh 145. So I'm back to almost my honeymoon weight. It's great because I pack my lunch every day. I bring everything with me in a cooler, and I eat at intervals every 4 hours, and I never skip a meal. And so when the night time comes, I'm not hungry. Once you decide which items are healthy, then every week you know what your shopping list is. So those are the strategies, and they work. The journey towards better health not only affected me physically, but mentally. I'm less anxious, I sleep better, I can get up earlier in the morning, I feel I have more stamina, more energy to do everything, and it makes you a better person all around. And if you take care of yourself, you can better take care of everybody else, whether it's your patients or your family, your loved ones. It affects your entire health and well-being when you are fit and when you eat well and get enough rest.